beautiful.
I'm thankful for my friend that she told me to come here, and honestly, I didn't think it would happen so quickly. I just, I thought I would come here a couple times and it would be a slow recovery, but it's been faster than I even imagined, so it's been...
Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor, and I have Liz with me this morning. And Liz was in yesterday, right?
Yes.
And what brought you in, Liz?
I just woke up, I was doing normal activities, but all of a sudden I had shooting pains in my back and I couldn't stand up straight.
So you don't know how it happened?
No,
it just,
nothing.
Out of the blue, there it was.
Yep.
And this is her second visit, and we treated her yesterday, and she told me she had to be out by what time?
Yesterday,
yes.
4:30.
So she gave me about 15 minutes to try to get her back to being human again. And so show us how you were standing when you first came in.
I mean, I couldn't even stand up. I felt like a hunchback. Like I couldn't stand up straight at all. This was about as much as I could do.
And it was uncomfortable bending backwards.
100%. Yeah.
You have 2 children?
Yes.
Ages?
4 and 18 months.
4 and 18, yes. So, and how would you tell me your 4-year-old weighed?
48 pounds.
I wonder if he had anything to do with it.
He's a big boy.
So how'd you get referred to us?
Erin Bull.
Erin Bull, yes.
She's a friend of mine. Yes. And she had nothing but great things to say, so I called and got in the same day, luckily, because I don't know how I would have kept going through life like that.
Okay.
Yeah.
And I tell you, and if she had gone, the traditional way of going about this was you'd have gone to the emergency room.
Okay.
You would have been there for a day and a half, and they would have given you an MRI and medication, and you would have walked out similar to the way you walked in.
Right.
So yesterday we did a physical examination, and then we did some active release on your psoas, which is that muscles in the front of your leg. We showed you an exercise, and in the office we use a McKenzie protocol, and we try to figure out what's the best direction to go, and it's forward or backward, and you were obviously forward yesterday, and so that helped a little bit, and then we adjusted your back, and you walked out
better.
Not as good as this, you're even better today,
right.
but you were better, and you were able to get through the night and things like that, right? Yeah. So and let's have you stand up tall. See, she couldn't even. This is really quite amazing, actually.
Yeah.
So bend to the left side for me. Go to the other side for me. Yeah. How's that feel right now?
Yeah. I mean.
It's like night and day,
yeah.
isn't it? Yeah. So let's get you on your side towards me. I've already adjusted one side, so we're going to finish up the other side on your side this way. You can lean right in. So this is pretty straightforward, right, Liz?
Yeah.
What time did you call to make your appointment?
It was after I picked my son up from school, so probably like 2.
2 o'clock.
And I got a 3:30.
3:30. And what time of the day did you aggravate your back?
Like 8 a.m.
8 a.m.
Yeah.
Okay. Was it going in the wrong direction?
Yeah. And I tried to take like 800 milligram Tylenol. I took it a couple times and felt 0 difference, so I was like, all right, I need help.
So you called your friend?
Yeah.
And said, what's the name of your chiropractor?
No, I was just telling her
your story.
my story, and she said, go, call them. So
That's awesome. And I want you to let this loose for me. I'm going to roll this hip down just a little bit more and look down for me on your back. Good job for me. Liz, does that hurt at all?
No.
Did it hurt yesterday when you were in so much pain?
No.
No, yeah. And I think that's probably one of the patients who don't know chiropractor, or who don't have a good friend like you who refer you in. I think that's always one of the biggest fears. And that's one of the nice things, to get someone who is in so much pain to share their experience.
Right.
So we appreciate that.
That it's not going to be worse. Yeah.
Yeah, no, you're, so now we're going to just take a little traction. There we go, beautiful. Again, loose. There you go, beautiful. Now slide up for me. Now let's have you stand up. So face Liam again. Let's see you bend to your left side. Yeah. How does that feel?
Really good.
Any discomfort?
No.
No. Try to go to the other side for me. Yeah. How does that feel for you?
Yeah. I mean, a little tight, but
And where do
night and day.
when you go to the right, does it hurt on the right side or does it hurt on the left side?
Right side.
The right side. So
Yeah.
it still pinches a little bit. Okay?
Yeah.
So what are your exercises to do at home every hour?
Pulling my knees back to
Yeah.
my armpits, and then the Mackenzie sitting in the
The
chair, and
okay.
pulling down.
Are you putting ice on it at home?
Yes.
Okay. Are you still taking the over-the-counter anti-inflammatories?
I tried this morning, but again,
Okay.
didn't feel anything. So
Okay. All right. That's awesome. I mean, it's like night and day.
yeah.
Okay. Anything else you want to share with folks?
I'm thankful for my friend that she told me to come here, and honestly, I didn't think it would happen so quickly. I just, I thought I would come here a couple times and it would be a slow recovery, but it's been faster than I even imagined. So it's been.
And I think some of that has to do with, what we try to do in the office with our physical exam, our history, is we always talk about what's generating the pain. There's it's musculoskeletal if it's in that category, right? It's a disc or internal derangement of the disc. It could be a joint dysfunctional, not moving the right way,
Right.
or it could have strained a muscle. And so some people have a combination of all, 2 or 3, all of those things, but there's something that's really what you just, because you were fine before, something happened to create this cycle and trying to get the right key for that situation. And I think for you, we were able to do that quickly.
Yeah.
I mean, you only gave me 30 minutes. Thank you, Baltimore.
I'm thankful.
Yeah, it's